When doing a low carb diet, I think there's one thing that people miss, and that's what we're going to discuss today. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients, helping them optimize brain function, body function, and supply the energy they need to get whatever outcome that they want. So when people are doing a low carb diet, and I don't think that there's anything wrong with a low carb diet, but I think that a lot of people go about it in a way that could be better. The health impacts of it could be improved upon. So when we look at a low carb diet, we stereotypically look at just protein, right? We're not having anything for fiber. We're not having anything for carbs. We're not really having any, well, fat is, you'll get a little bit more of that, right? And that's okay. It works really well. I see a lot of people that are doing really well as far as dropping their blood sugar numbers, people that are doing really well as far as dropping weight, and they're able to sustain their muscle mass, which is a massive thing because with the medication approach, the semaglutides out there right now, I see a lot of people that are losing weight, and the form of weight that they're losing is they're losing muscle. And right now, that may not seem to affect you that much. But as we start to get older, we've got to have that baseline of strength, because if we don't have the strength now, if we lose that muscle mass, and then, 40 years from now, we need that strength, where are we going to get it? We've got to have that base of muscle. So when we start losing muscle mass, it's a massive, massive concern to me. And then the other aspect of that is if we don't have that muscle mass, where do we put the blood sugar? If you go back to eating your normal diet or whatever else, where do you put the blood sugar? The blood sugar it goes into the muscles. So if you do a few squats before you eat, if you go for a 15-minute walk after you eat, different things like that, you start to push that blood sugar into the muscles and gets it out of your bloodstream. It's a good thing, right? If you don't have enough muscle mass, what happens? Where do you put it? You can't do any of that stuff. Like, yes, you still get some benefit, but the more muscle mass you have, the better it is for your overall health. So I think that this is a better outcome for most people. And the reason that I recommend the Mediterranean diet in most cases, it's easier to sustain than some of these other diets, right? So when we look at just a low-carb diet, if we look at just something that's very restrictive, it's hard to do that for the long term. You tend to go somewhere or do something and you're like, all right, it's just not worth doing it today, and you get off it. If you're not consistent with it, it doesn't work, right? So Mediterranean tends to work a little bit better. You have a little bit more flexibility. And when we cross the two of these and we look at a low-carb diet, if you take a low-carb diet and you add in fiber, so you're still eating vegetables. Those vegetables don't tend to have a whole lot of sugar. So it's probably not going to tank your diet. You're probably not going to be, really throwing off your results or anything like that. However, there are added benefits to this. When we look at the gut itself, the gut is filled with bacteria, right? The more different types of bacteria we have, the better off we're going to be. Certain types of bacteria are supposed to be localized in certain parts of the gut. We don't want those parts to move. So the gut bacteria, we don't want the ones in the colon to move to the small intestine, or we don't want the ones in the small intestine to move to different parts of the small intestine, or different things like that. We want to have that barrier. What we see is that the fiber is what a lot of those species eat. So when we feed the fiber to ourselves, we actually feed the gut microbes that we need to help us with health. And not only do they help with metabolism, they help with producing neurotransmitters, the things that drive brain function. So depression, you don't have enough serotonin. Serotonin, a lot of it is produced in the gut. So we have a lot of gut dysfunction in things like this. We have a lot of gut dysfunction in diabetes. We have it in autoimmunity. We have it in almost every chronic disease that we face. So when we start feeding those better bacteria, we start having a proliferation of those. We start seeing more of those. They start to grow and expand, and we get more benefits from that. Fiber is what they eat. What happens if you don't have fiber in there for them to eat? They start eating the gut lining. They start eating the mucus that we produce, right? So if they start eating that mucus, it wears away, and it allows other things exposure to our actual gut itself. So other things get into our system, and when they get into our system, not only are they highly inflammatory, but they're also pathogenic. So they can lead to, just like what we talked about, we can have autoimmunity, we can have allergies, we can have all of these other things that start to go on with it. So very, very important to actually feed the bacteria. It's very important to have a balance of the right bacteria. And while some of that is, passed on from your parents, I mean, that's where you get most of it if you are, a natural birth, cesarean section. They're doing some things now to make that more robust, let's say that. But we still get populated by different things. So if you're born in the hospital, you pick up some of those bacteria that are in the hospital. Taking probiotics are something that can work well for that. But every time we take antibiotics, it kills off a lot of those gut bacteria. Those gut bacteria that can be beneficial in most cases are the ones that suffer. So having something to repopulate those, a probiotic, and when we do a probiotic, we don't necessarily just want one strain of things. We want a few more different strains, because the more variability we have in the gut, the more health we tend to have. So when we can take a more broad spectrum probiotic, that tends to help, but we've also got to feed it. And that's why I say make the one change. Just start adding some vegetables in with your low carb diet, and I think you're gonna like the results. Not only does it give you a little bit more flexibility, it gives you that fiber, and it's also going to keep you're going to keep the benefits, right? Because most of that, you're not getting a whole lot of sugar. You're just getting the fiber, and that fiber is okay. That fiber feeds the different things like that. It's not going to lead to a spike in your blood sugar. It's not going to lead to all the negative consequences that carbs are associated with, right? Because they're not the same carbs. They're hydrated fiber, which is what we need. So try the small switch, see how you like it. Let me know. If you have questions, drop them in the comments or send me a DM, and we'll try and get those answered. As always, I love and appreciate you guys. I know that your time and attention are your biggest assets. I appreciate you spending some of that with me, and I'll catch you on next week's video.